I'm here now out front of Bowmanville Hospital, a part of Lake Ridge Health, where today a temporary closure of its intensive care unit was declared. Various opposition parties in the Ontario legislature were quick to respond to the temporary closure. NDP Health Critic France released a statement asking, where is Sylvia Jones? Sylvia Jones being the new health minister that was just recently appointed by Premier Doug Ford. And of course, the crisis that is being felt at hospitals like the one I'm currently standing in front of is something that is being felt by not just this hospital, but many other hospitals across the province of Ontario as well. And of course, as the crisis is the shortages, nursing shortages, and the shortages in units such as the intensive care unit is being felt by many hospitals. People are calling for action, including opposition parties in the Legislative Assembly of Ontario. Of course, as I mentioned, there is the NDP who are calling on Health Minister Sylvia Jones to address the crisis. Of course, the Health Minister has not been doing any interviews with the media. I did request an interview with the Health Minister, but did not hear back from them. I also requested a statement on it, but also did not hear back from the minister nor her team. So that is what the NDP is calling the issue, not necessarily hearing too much on the issue from, say, the health minister. They obviously, this crisis has been going on even before the last election campaign. Obviously, it was an issue of great concern and of great discussion during the most recent election campaign in the province of Ontario. And obviously, this crisis, nursing shortages, a lot of nurses say they feel burnout from what is happening at hospitals across the province and really, as of most recently, across Canada as well. Joining me now for his perspective on what we've been hearing about all day in the temporary ICU closure at Bowmanville Hospital in Lake Ridge Health is DJ Sanderson, who is the Vice President of the Ontario Nurses Association. Thanks so much for your time. Let's just start out with that piece that I mentioned. To what extent are you concerned with the closure? Obviously, I know you're probably quite concerned with the closure, but specifically, how concerned are you that this closure could be also something that could happen at other hospitals across the province of Ontario? And furthermore, what should the Ontario government be doing and the government be doing to ensure that this doesn't happen at other hospitals?
Well, thanks for your question, Wyatt. And there's actually about 14 different closures or service reductions at Ontario hospitals going on this weekend. But specifically out in Bowmanville, the closure of this ICU is horrific, and the impact that it's going to have on the community out there. Well, we'll have to see exactly where that goes. A number of the patients that rely on that service, it's such a valuable service to be able to provide for those folks in their home community, and to move them to another hospital about 100 kilometers away. It's unspeakable. I can't believe that this is happening actually in Ontario. But specifically, when you close an ICU, it's so much more than just the closure of those ICU beds and that resource that's no longer available to the patients in that area. Most often, emergency nurses and critically care or ICU nurses, they're also the rapid response team for the entire facility. So in off hours, certainly over the long weekend when you may not have as much physician support, or you need to be able to rapidly assess and troubleshoot problems if patients change in acuity, it's often that ICU staff that they rely on. So to take that away from the community is shocking, to be quite honest. And, we really worry for the people in Ontario that are relying on these hospitals to be there when they need them.
Of course, the healthcare shortages that have been felt by many hospitals across the province of Ontario was reflected again today as a temporary intensive care unit shortage was declared at Bowmanville Hospital in Lake Ridge Health. And joining me now to discuss that, as well as the general idea of healthcare closures around and across the province of Ontario, is France, who is the Ontario NDP's Health Critic. France, thanks so much for joining the show once again. Perhaps we can just start out with that piece that I mentioned. What ultimately should the government of Ontario be doing in order to prevent further closures like the one that is currently taking place at Bowmanville Hospital and Lake Ridge Health, again, from happening at other hospitals across the province of Ontario?
So everybody understand that healthcare is delivered by people. Those people, those healthcare workers, have had a really tough 2.5 years since COVID started in March of 2020. They have been giving out 110% every single shift, every single day. And many of them are having a tough time, and there is so little support for them. So to start out, Bill 124. Bill 124 demoralizes them. This is something that the government of Ontario could get rid of today so that we help with, taking away this demoralizing and disrespectful piece of legislation. Same thing, we have seen it was hard on our healthcare workers, but it was also hard on all of us in Ontario with the shutdown, with the learning from home, and all of this. So now, for a lot of healthcare workers, they face a lot of violence and harassment. Yet, if they report violence or harassment, they are the one who get punished. This has to change. We have to trust that if a healthcare worker comes forward to say that they have been facing violence or harassment at work, to take them seriously and to help them with this. And then we have right here, right now in Ontario, over 15,000 nurses, internationally trained, who have waited years and years to have their credential looked at, to see that for sure we want to have them assessed so that they are capable of providing quality care in Ontario. But it should not take years to do this. So there are many steps that a government could take to help, because coming to the hospital and realizing that the emergency room is closed, locked down, and you have to go someplace else, having a loved one in an intensive care unit, you have to be pretty sick to be admitted into a hospital, and you have to be even sicker to be admitted into an intensive care unit. And now you're being told that your loved one, who is the sickest they've ever been in their lives, will be moved out of town while they are maybe on a respirator, on all sorts of machines to keep them alive. That's not quality care, and that should not be happening in a place like Ontario.